is Julia Speight, and I'm a practice nurse at Woodlands Health Centre in Paddock Wood. So I trained to be a nurse in the States. So I did my BSN in the States, and then I married an Englishman. So I ended up over here. Then, like a lot of people, I took time off to have children, and when my youngest went into secondary school here, I decided it was time to get back to work. I'd worked in acute care, what we call secondary care here in the States. So I had let my registration lapse because I wasn't doing anything, but I knew I didn't want to go back into the hospital. So I had a friend who does some training, and she said there's bound to be forward-thinking practices out there because we need practice nurses, and I really wasn't aware of the role at all. So I just started emailing everyone I could find online. I found the workforce development tutor for West Kent, and she said, absolutely, let's see what we can do. She helped me enroll in the return to practice course at CCCU, and then I came here to Woodlands for my final placement for that course and never left. It's academic study and then placement. So they go through and they make sure you're up to date on all the skills that you need to be up to date. They go through the sort of information and governance and let you know how the healthcare is organized. It just gives you a basic overview. And then you write papers and you do case studies and things like that just to make sure you're up to speed with the latest guidelines, reintroducing you to the code, or for me, introducing me to the code, making sure that you understand what your responsibilities are as a nurse. There was a lot of support. The course was actually, I really found it supportive. There was lots of educational events that we were invited to, nursing conferences, every kind of educational event that you could think of, we were offered to go to it. So we were able to take advantage of that. And that made a big difference, getting out and seeing, the type of courses that you'll be taking once you were back on the register, what type of CPD you would be doing. So, and I found it incredibly supportive. I thought the university was brilliant, the tutors were brilliant, and my mentors, as they were called at the time, were absolutely brilliant. We got a bursary, $100, $500, something like that bursary, in order to help arrange whatever you needed it for. If you needed it for transportation, if you needed it for childcare, whatever you needed it for, it was just money that was handed over saying this is to help you facilitate being in the course, because we're all adults, we were all having our lives as well that we had to manage, as well as doing this course that was an academic course. It's slightly different than returning to work. So yes, there was some financial help with that, and it wasn't beneficial. So she contacted me and said, can you take a return to practice student? You were one, you understand how important the program is, because it's slightly different than the nursing students, the traditional nursing students. So I said, yeah, sure, I'll see, let's see what it involves. So I was speaking to the program director, and it seemed like something we could do, because at the time we didn't have any other students, and we are a teaching practice, so we quite encourage students to come through. So taking her on, and she will be, it's 150 hours that she'll do through August, so it's not a full-time huge commitment. But yeah, so she will be here. She will have access to a mentor separately. I will be her practice assessor. So I'll be the one that will actually sign off saying she is qualified to return to the register. I'll be the one checking her and going through and making sure that she's happy and I'm happy with her. They've got a booklet that you sign on. And then she will be offered a separate mentor through a mentoring program that's run through the training hub. And that's somebody that will be completely separate that she can have as a mentor if she chooses. Absolutely. I was a bag of nerves because I had no idea what to expect. Like I said, I didn't even know, I didn't train here, so we train slightly differently in the States. I was a bit nervous. I knew I was competent, but would I be able to fit it into how it was done here? And it was a very steep learning curve, I have to say, on some issues. More how the NHS is arranged, how things are done. Well, I think it all depends. For me, I was getting bored really kind of at home. Like I say, my youngest child was going through secondary school, and you do kind of take a step back here. They should return if they want to. I think that as nurses, we tend to want to contribute, we want to help. You saw during the pandemic how many nurses volunteered at the vaccination centers, and did the things, and we're working extra hours, and we never stopped providing the smear program, doing childhood immunizations, all that kind of stuff. We've soldiered on and carried on through, and you've seen the photos, the pictures of the nurses at the hospital, how dedicated they are. And part of it might be a little altruistic in that, wanting to contribute, wanting to give back, because our NHS needs help right now. We need nurses right now. But generally nurses want to help, they want to pitch in, and I love my job. I do. So if you are feeling unfulfilled, so to speak, which a lot of nurses are very much doers instead of watchers, then perhaps returning to nursing in some way or form. It doesn't mean you have to go into the wards in the hospital. There are lots and lots of things that you can do as a nurse that you could contribute, feel more fulfilled perhaps,